Medicare Penalties. So when we talk about Medicare penalties, we are referring to Medicare Part B, the medical program through Medicare, and Medicare Part D, the Medicare prescription drug program offered through private companies. And penalties are a result of your failure to enroll within the given time period that Medicare has set. Now, Medicare is about helping older Americans, but they'll tell you if you procrastinate in enrolling in Medicare Part B or Part D, there'll be a cost associated with it. So some people will say, well, why are there penalties at all? And Medicare says they're meant to discourage you from passing up on Medicare coverage and then getting hit with costly medical bills down the road. Now, there's another narrative that's going on with Medicare as well, and it has to do with Medicare Part B, the medical program issued by the federal government. Now, if you look at 2002, just 20 years ago, Medicare was only $54 a month. And as time has gone on the last 20 years, we've seen a 215% increase in the cost of Medicare. So, because this is relevant, Medicare needs everybody on board to pay into Medicare to help it with its own solvency. Now, Medicare Part D, the prescription drug program, works much the same way. Now, Medicare Part D isn't rolled out by the federal government. You have to literally go out and buy a drug program from a private insurance company. And yes, there's a penalties associated with failure to enroll within the given time frame. So much like Medicare Part B, they need all hands on deck paying into the system in hopes that it'll keep it solvent and sustainable over time. Now, the Medicare drug program is optional. So for the person that doesn't take any medications, it's easy to say, hey, I don't want the Medicare drug program. Why would I pay a private insurance company a monthly premium and enroll in something that I'm never going to use? I don't take medications. Now, the good news is that Medicare gives you a 7-month window in which to determine whether you want to enroll or not. This is known as your initial enrollment period, basically 3 months before you turn 65, the month of, and 3 months after. So that is your time frame to decide. And if you don't do it within that given time frame, they are going to hit you with a 1% penalty. Now, the penalty is based on the national average premium, which is issued by the private insurance companies. And at the time of this recording, it's 34 cents. So what you'll do is you'll take that 34-cent penalty and multiply it times the number of months you should have had prescription drug coverage and didn't. So for this demonstration, let's say you didn't have drug coverage for just over 2 years, 25 months. So you'll take your 34-cent penalty, you'll multiply it times the 25 months, only to discover that the penalty, even for something as long as a little over 2 years, is only $8.50. And human nature would say, well, hey, I'll just pay the penalty. But there's something else you need to be aware of. So even though you don't take medications now, you could end up taking medications in the future. And it happens all the time. Take, for instance, Lantus. The retail cost of Lantus is $400 for a 30-day supply. Now, that is extremely expensive, and that's not totally out there compared to other brand name drugs. So you may say, well, that's fine. If that happens to me, if it happens, I'll just enroll in a Medicare drug program at that point in time. And I know that if I find one that participates in the prescription savings program, that I'll only have to pay $35 for that Lantus, which means you're not going to end up paying the $400 per prescription. You'll put that on the back of an insurance company. And so for this demonstration, we'll say you look for a plan. Let's say it's $20 a month. Now you got to add that $8.50 a month penalty to the premium, and you come up with the $28.50 a month. Now, looking at this, it would make sense to just wait to enroll in a Medicare drug program, pay the penalty, and you'll be okay. But that's not the problem. The problem isn't the penalty as much as it is that you bypassed your initial enrollment period. So if this is you, you will have to wait for the Medicare annual enrollment period to get into a Medicare drug program, and that time period is October the 15th through December the 7th. And so between now and then, since there is a limited time to enroll in the Medicare drug program, you're basically going to eat the cost of that medication until you can get a plan. Now, because the restricted time frame of October the 15th through December the 7th is when you can get a plan, you're going to be eating the cost of brand name drugs, generic drugs, until you can get the plan. But your coverage actually won't even begin until January of the following year. So the problem is less about the penalty for Medicare Part D and more about if you need help paying for prescription drugs, you may not be able to get into a plan for a very, very long time. Now, Medicare Part B, as in boy, is totally different. Because Medicare Part B, the medical plan, isn't run through private companies, it has different rules about how it operates. Now, Medicare Part B is the bigger part of Medicare. This is your medical plan. You're talking about doctors and specialists and those services that you're more than likely to have to access when you go on Medicare. And in 2022, there's a premium of $170.10, and that applies to most people. That's like your middle-class Americans. So some folks will say, oh my gosh, I paid into Medicare my whole life. I didn't know I was going to be hit with a monthly premium of $170. I can't afford it. And so Medicare is not going to allow you to do that. But there's other people that may have some sort of medical coverage. So for the person that already has medical coverage that is turning age 65 and they look at Medicare Part B with a $170 price tag, they may say, well, why do I need more medical coverage? I already have it. And so you may even have a medical insurance card. It'll have some co-pays on there. And you'll say things like, hey, you know what? I'm really happy with what I have. Medicare Part B is also optional. So you can reject it and say, hey, I like the coverage I have. I'm just going to keep it. But just because you like it doesn't mean that Medicare says it's as good as Medicare is. And even if you think it is, Medicare is the authority on this. So if Medicare determines that your current health coverage isn't as good as theirs, they're going to tell you that your plan is not creditable and you'll be faced with the penalty. Now, the penalty for Medicare Part B is significantly higher than that of the Medicare drug program. You will incur a 10% premium increase for every 12-month period you should have had creditable coverage and didn't. And so the excuse of, hey, I didn't know that my medical plan that I had through my own insurance that I loved, I didn't know it wasn't credible, isn't an excuse. Medicare will not care, and you still will end up paying the penalty. Now, we see this most commonly with veterans. So veterans have excellent coverage through the VA, and there's different levels of VA care, but most veterans don't know that the medical coverage that the VA gives them is not creditable in Medicare's eyes, which is strange because the Medicare drug program that the VA rolls out for veterans is creditable. It's just the medical coverage that isn't creditable. And so when it comes to your current health insurance plan, when you're turning age 65 or when you're becoming Medicare eligible, assume nothing about the plan. Do your due diligence and make sure that your plan is considered creditable. And the best person to ask is normally your human resource manager. So let's look at calculating the Medicare Part B penalty. Now, we know the percentage, it's 10% for every 12-month period, but you have to know when the penalty actually begins. Now, for somebody just turning age 65, you don't start that penalty until the 4th month after you turn age 65 or become Medicare eligible. Or for those people that did delay their Medicare Part B and they did have creditable coverage, let's say they involuntarily lose their group health coverage, and let's say they're age 67, and in that scenario, even though you had creditable coverage in Medicare's eyes, if you go 63 days without it, even if it's just because you involuntarily lost it, you'll start to accumulate the penalty. So what you'll do is you'll take each 12 12-month period to calculate how much you're going to pay in a penalty. So in this demonstration, we have 3 12-month periods. Therefore, 30% will be added to the Medicare Part B premium. And so you may say, well, hey, I've got an idea. If that happens to me, no problem. I'll just call Medicare up and I'll tell them I want to enroll in Medicare now. I want to prevent any more penalties from accumulating. But just like the Medicare drug program, if you waived off your initial enrollment period, there's only 2 ways to get Medicare at that point. You'll either need to find a special enrollment period, or the majority of folks will have to enroll in Medicare during the general enrollment period. Now, the general enrollment period runs from January the 1st through March 31st of every calendar year. And even though you will apply for Medicare during that time frame, your coverage actually doesn't begin until July later that year, which means you can continue to accumulate more penalties from Medicare while you wait for your effective date of coverage to begin. Now, we know the percentage amounts of both the penalty for Medicare Part B and Part D. But one other thing you must consider is that these penalties are enforced for the duration of your life. Now, you can file appeals for the penalties, and there's special things you can do with the Medicare drug program that really have to do with your amount of money that you earn each year. And we really won't get into that in this video. But calculating that exact dollar amount can be extremely complicated. Everybody has a very different situation, and we've only covered a few situations in this video. So if you're worried about what your Medicare penalty will be, or how much it'll be, or even if you have one at all, our recommendation is to call a Medicare Pro and let them work with you to figure that out. You just go to our website and you click on the tab Medicare Pros, and for free, a Medicare Pro can tell you if you're subject to a penalty or not.